Thank you, Shoshana, and good afternoon, everyone. We're glad you could join us for this second call in April. Today, we'll be exploring an area that doesn't get as much attention as some of our other processes like DMS or SPP APR or your grant awards. But another significant component of MSIP's and OSEP's work is policy development. Over the last 6 months or so, we've issued a number of policy documents, which we'll be highlighting for you today. But before we get started, I wanted to introduce our Deputy Director, David Cantrell, who has just a few words for you. David?
Thank you, Greg, and good afternoon, everyone. I hope everyone is doing well. It is a wonderful spring day here in Washington, D.C. So hopefully, finally, we're over the winter plunge. So yesterday, I sent out an email to all of you, and I just wanted to put a plug into a webinar we're having next Thursday, May the 4th, from 3 to 4 p.m. And this is a unique funding opportunity for states that I wanted to make sure that you were aware of. This is a discretionary grant from our Office of Rehabilitative Services, the Disability Innovation Fund Pathways to Partnerships Innovation Model Demonstration Project. The project or the grant award is about $225 million. And this is a unique funding opportunity to position state education agencies to apply and receive multiple these funds for multiple innovation model demonstration projects, which are focused on systemic approaches to transition services for children and youth with disabilities. This is in partnership with our RSA colleagues. And I wanted to make sure that you were aware because states are eligible to apply as well as other national organizations. So if you are interested and you did not receive my email about the training, just please let me know. And I look forward to speaking with you next Thursday. So Greg, I'll turn it back over to you. Thank you, everyone.
Thanks for that announcement, David. Today, we're going to be discussing 9 policy documents that we have issued over the last 6 months. We've divided those into 3 areas: early childhood, statewide issues regarding serving children with disabilities, and IDEA implementation issues at the lead agency and state education agency levels. As Shoshana said at the beginning of the call, time permitting, we will try to respond to some questions that you've placed in the Q&A, not the chat, but the Q&A. So if you do have questions that occur to you during presentations for any of these letters, please enter those. We'll save those to the end rather than kind of break the flow of the presentation. Leading us into our discussion today is Dan Schreier, who is the policy specialist in the Office of the OSEP Director. Dan, I'll hand it over to you.
Okay, good afternoon, everyone. Thanks for joining us this afternoon on a very interesting and a very action-packed agenda here. So we're going to go through a lot of different guidance on a lot of different topics. So just a couple of thoughts and to kick this off. One is a big thank you. I mean, there's a lot of OSEP staff who spend a lot of time in researching these topics, discussing it with leadership, developing the content and writing the actual guidance or letters. It is not something that is easily accomplished and takes a lot of time to do. So a big thanks to the colleagues who are on the call today and other colleagues who've actually played a large role in writing these. So I can't thank them enough. The second thing I do want to give our sort of a formal disclaimer is that if you've ever looked at an OSEP policy letter, we are required by statute, actually, it's written into IDA section 607 IDA, to say that these really are an interpretation based on the facts presented to us. So while I think there's a lot that can be drawn from the letters, they really do come in from real live people who all across the country, right? And it's amazing that almost 50 years into implementation of IDA, we still get lots and lots of questions, but we do. And so they are very fact specific. But the nice thing about our letters, if you haven't looked at them, I would encourage you to, and thanks for Shoshana to dropping the link in the chat. But they really are fact specific, but we tend to, if you've been to law school, there's a concept called Iraq, not the country, but it's IRAC, where we look at an issue, we discuss the rule or the legal sort of analysis, then we do the analysis, and then we draw a conclusion. So, so to the extent that these letters can be helpful for you in a similar situation in implementing IDEA, we highly encourage you to look at them. We know courts do defer to them as our department's interpretation of IDEA, and so it is that they're definitely labors of love. So I can't thank the staff enough who work with me and work with OSEP leadership in getting these issued. So without further ado, I think we're going to go right into the letters. You can see we'll go right to our dear colleague letter on services in Head Start.
Thanks, Dan. Hi, everyone. Good afternoon. I'm Jeanette Guerra. I am on the OSEP early childhood team and happy to kind of kick us off today with early childhood issues. So this first letter, if we could go to the next slide, please. The first letter is a Dear Colleague letter issued last October that addresses the provision of IDEA services in Head Start classes. The letter was developed and issued jointly with the Office of Head Start and really has kind of a threefold purpose. First, we remind everyone that state education agencies, local education agencies, and Head Start programs all have responsibilities for implementing IDEA and specifically the provision of special education related services to eligible preschool age children with disabilities in the least restrictive environment. And so in that context, SEAs are responsible for establishing and enforcing policies and procedures to ensure full implementation of Child Find and FAPE under IDEA. LEAs are responsible for the identification, locating, and evaluating children suspected of having disabilities in a timely fashion, and developing and implementing IEPs for eligible children with disabilities in accordance with the applicable IDEA requirements. And Head Start programs have a responsibility to refer children and families for IDEA evaluations, as well as supporting the ongoing implementation of children's IEPs that are in their programs. Second, we emphasize the importance of ongoing collaboration between the SEAs, LEAs, and their Head Start program partners to effectively meet the IDEA requirements and ensure the provision of FAPE to children with disabilities. Lastly, the letter provides resources to assist in implementing high quality early childhood programming for all children. And so there's no new information or guidance provided in this letter that we haven't previously issued. However, in discussions with our partners at the Office of Head Start and considering all the challenges that the pandemic really compounded, for example, completing timely evaluations to determine eligibility or implementing IEPs in least restrictive environments, we agreed it was necessary to come together again and jointly issue this letter to the field. Next slide, please. So as we think about implementation of the requirements and concepts this letter addresses, there are a few considerations we offer. So first, there has been longstanding policy and guidance issued both individually by OSEP and OHS, as well as jointly, that interpret the requirements of IDEA and Head Start program performance standards. Because understanding each other's roles and responsibilities is absolutely critical for effective collaboration. And this isn't something that is a one and done activity, right? This takes continuous, consistent, and intentional efforts and really cannot be understated, especially as we face the workforce shortages and high rates of turnover that are so common across all early childhood, early care and education programs. Second, this letter emphasizes the requirements of timely evaluations because it is one of the issues most commonly voiced from the field. Again, we've addressed this in the past and the requirements haven't changed. You may remember that OSEP previously issued OSEP Memorandum 1607, and we just re-released this guidance, making clear that MTSS or response to intervention strategies cannot be used to delay or deny a timely evaluation for a preschool child suspected of having a disability. Again, this memo was just re-released, because there continues to be questions and issues that are impacting timely evaluations for preschool children. The companion document that was released with the Dear Colleague letter, Guidance on Creating an Effective Memorandum of Understanding to Support High Quality, Inclusive Early Childhood Systems, long title, provides very specific implementation strategies and considerations to effectively formalize these working partnerships. And so we're going to dig into that in just a moment. That'll be the next document we look at. But first, I also just want to point out that the OSEP and Office of Head Start affiliated TA centers offer multiple really valuable resources to support implementation of high quality inclusive programming. Next slide, please. So now I'm going to move into that second document, which, as I just mentioned, is the companion document to the Dear Colleague letter, released at the same time. And again, this guidance, as with the letter, was developed and issued jointly with the Office of Head Start. And so a memorandum of understanding, or MOU, is one way to articulate and formalize the collaborations that the Dear Colleague letter references as being critical to build a meaningful, inclusive early childhood system. So the purpose of this document is to provide an overview of factors for states to consider when developing, implementing, and sustaining an MOU at the state level in order to create that seamless, coordinated approach to service delivery, ultimately to improve outcomes for all young children. We know that the research and the benefits of inclusion are clear, and yet our LRE data, which we know is only one part of the inclusion story, has been mostly stagnant. And so we know that we still have a lot of work to do to create the infrastructure pieces necessary to build, again, that seamless system in our vision. So an MOU is one component of infrastructure, and we suggest 4 potential purposes an MOU might address. One, the MOU could be the method to ensure the provision of and financial responsibility for Part C services. It could be the mechanism to operationalize the IDEA child find mandates. An MOU could meet the IDEA requirements for intra or interagency agreements around transition from Part C to Part B services. Or it could serve as the mechanism that outlines data sharing agreements. So an MOU might include any one or all of these intents and purposes. And the guidance really walks through the who, why, what, where, and when about developing and maintaining effective MOUs. Next slide, please. So this guidance is all about implementation, but I really want to draw your attention to just a few specific considerations. First, it uses IDEA programs and Head Start programs as the example throughout, but these concepts can be applied to all early childhood partners. But we would expect at least that states have MOUs in place with at least their Head Start partners. Additionally, this resource, the concepts can be used at the state level and the local levels to operationalize those collaborative roles and responsibilities. An effective MOU describes, the way we've approached it, describes what each agency will do within each component of the service delivery continuum to ensure an equitable, coordinated, family-centered approach and the efficient use of all agency resources like time, personnel, fiscal resources, all within the parameters of all applicable local, state, and federal requirements. So Table A in this document at the end of it provides examples of collaborative practices at each phase of the service delivery system, from identification through evaluation, IFSP and IEP development, implementation, and then transition. It also includes considerations for joint professional development. And so we just want to caution, and it's in the document as well, that these are these are examples about practices at the local level and are not in any way meant to be included in every MOU. It's really just a place to start thinking. MOU development teams are encouraged to be creative and innovative when thinking about their coordinated responsibilities during different processes and procedures. And so as teams develop and review state level MOUs, one thing to think about is if there are state policies or procedures that either support or impede the recommended practices that local programs are struggling with implementing. And so what then might you need to include in a state level MOU? Also, as we all face, again, increasing personnel shortages and high turnover across our early childhood systems, think about how a well-developed and maintained MOU could help bridge that gap in historical knowledge and sustaining well-coordinated, inclusive early childhood systems. And so with that, I'll leave you to ponder some of those things as I turn it over to my colleague, Sabrina Austin.
Thank you, Jeanette. Good afternoon. I'm Sabrina Austin. I'm a state lead here, and I also provide support with the policy work that we do. I'm going to speak first about the letter to NICS, which was issued in March. Letter to NICS was issued in response to correspondence from a California stakeholder who asked a series of questions about the requirements under IDA related to the transition of toddlers with disabilities receiving early intervention services under Part C, who may be eligible for preschool services under Part B. The IDA imposes transition requirements under Part C that apply to state lead agencies and EIS providers, and under Part B that apply to state educational agencies and local educational agencies. Taken together, the transition requirements are intended to ensure a seamless transition of toddlers from Part C to Part B. Letter to NICS clarifies the IDA responsibilities and requirements for early childhood transition. The first step in the transition process is the development of a transition plan. This requirement applies to all toddlers exiting Part C, and not just those who may be potentially eligible for preschool services under Part B. The plan must be established in the child's ISP and will reflect steps for the toddler and their family to exit the Part C program. The next step is the requirement for lead agencies to notify the SEA and the appropriate LEA of the toddlers with disabilities who have been identified as potentially eligible for preschool services under Part B, who will be reaching their third birthday within no fewer than 90 days. If the lead agency has adopted an opt-out policy, the transition notification must be consistent with that policy, and the EIS provider must inform parents of the transition notification and give them the required amount of time to object. If the parent objects to the disclosure of the transition notification, the EIS provider cannot make the notification. The transition notification is critical to ensure that Part B agencies can meet their responsibilities under Part B, particularly their child find obligations. Part B must know which toddlers will be reaching the age of eligibility for services under Part B. Therefore, a lead agency's transition notification to the SEA and LEA must be treated as a referral for IDEA Part B services. Next slide, please. The next requirement is for lead agencies to hold a transition conference to discuss any Part B services the toddler may receive. The lead agency must invite the LEA to the conference. They may, but are not required, to combine the invitation to the conference along with the transition notification that is provided to the LEA. This starts the process for LEAs to obtain parental consent for an evaluation if they suspect the child has a disability under Part B. If the LEA does not suspect that the toddler has a disability under Part B, they must still provide parent with a prior written notice, as well as the procedural safeguards that are available to the parent if the parent believes the child should be evaluated. The lead agency may conduct the conference without LEA participation, but only if they have provided the LEA with timely notification of the conference. Keep in mind that the accessibility, convenience, and participant requirements that are applicable to IFSP meetings also apply to the transition conference. Moving on, let's talk about late referrals. These are referrals to Part C that are made less than 90 days before a toddler's third birthday. The responsibilities here depend on when the Part C referral has been received. If it's received between 45 and 90 days before the toddler's third birthday, and the lead agency determines that the child is eligible under Part B, they must notify the SEA and LEA as soon as possible after that determination. If the referral to Part C is received fewer than 45 days before the toddler's third birthday, Part C is not required to determine the child's eligibility under Part C. However, if the lead agency suspects that the toddler may be a child with a disability eligible for preschool services under Part B, they must, if the parent consents, refer the child to the SEA and LEA. Finally, as everyone knows, state lead agencies and SEAs must report on their compliance with IDEA's early childhood transition requirements through the SPP APR indicators in C8, B11, and B12. This is how we track and look at whether or not the early childhood transition requirements are being met. Next slide. So, implications and takeaways here. It's important to really focus on the fact that because both Part C and Part B agencies have responsibilities for ensuring a smooth and effective transition for toddlers exiting Part C who may be eligible for Part B services, they must work closely together at the state and local levels. There's a timing element to the transition requirements, most of which must occur no later than 90 days before a child's third birthday, although some can be carried out earlier at the discretion of the parties, up to 9 months before a child's birthday. As mentioned before, it's important to keep in mind that a lead agency's transition notification to the SEA and the LEA must be treated as an IDEA referral under Part B. Failure by the lead agency to invite the LEA and the parent to the transition conference would be inconsistent with IDEA. The LEA is required to participate in the conference. Therefore, an LEA's failure to participate in the conference would also be inconsistent with IDEA. Finally, the transition requirements have an impact on your APR reporting. Here, OSEP monitors both SEA and lead agency compliance with the transition requirements annually through their SPP and APR reporting. Not included in the slide is a resource that may be of interest. I will put it in the chat after the meeting, but it's a document that was prepared by ECTA on OSEP early childhood transition FAQs in December of 2009. At this point, I would like to share that OSEP is currently working on the development of updated guidance on C2B transition, and that will hopefully be released in the fall. Next slide. I'm going to transition now, next slide please, to the letter to Sharpless, which was issued in November 2022 in response to correspondence received from a Virginia stakeholder asking about the requirements relating to a parent's request for an initial evaluation under Part B. The question specifically focused on an LEA's obligations when a parent asks for testing because they think there may be a problem with their child, or similar wording such as asking the school to test their child during a conversation with school staff, and whether these types of requests are considered a request for an initial evaluation under IDEA. IDEA requires states to offer FAPE to each eligible child with a disability residing in their jurisdiction. To meet this obligation, SEAs and LEAs must implement the IDEA child find requirements in Part B, which require them to identify, locate, and evaluate all children with disabilities needing special education and related services who reside in their jurisdiction. IDEA does not, however, establish any specific requirements about the manner in which a request for an initial evaluation must be made. Therefore, states are allowed to develop their own procedures or requirements for conducting child find activities, such as requiring the request to be in writing or requiring the use of a specific form. However, states cannot develop procedures or requirements that would be inconsistent with IDEA or that would substantially limit a parent's right to request an initial evaluation under IDEA. Next slide, please. States need to keep in mind that they may need to assist parents with making a request for an IDEA initial evaluation. Some considerations include whether a parent is aware of how or when to submit a request, or of any specific language or terminology that must be used to make the request. Staff may need to assist a parent with understanding the procedures for requesting an evaluation, or with completing a required form to request an evaluation, due perhaps to a parent's lack of computer or internet access, or having limited English proficiency. All of these things could substantially limit a parent's right to submit a request for an IDE evaluation. Therefore, states are encouraged to review your rules and procedures and determine whether they create any barriers for a parent to request an initial evaluation. If there are procedures that a state has that require steps that pose a substantial limitation for certain parents to access an initial evaluation for their child under IDEA, the failure to provide additional information or assistance in these cases could potentially violate IDEA's child find obligations. The letter to Sharpless includes some examples of reasonable and appropriate responses for school personnel to take, and OSEP encourages states to determine if their child find procedures offer fair and equitable opportunities for all parents to request an initial evaluation under IDEA. And next, I believe, is Dan. Oh, no, I'm sorry. We're going to return back to Jeanette for the next discussion. Thank you.
I think so. Next slide, please. Let's be sure. Next slide, please, Shoshana. Okay, is this Dan?
Dan, you're on mute, Dan.
Thank you. It's only been how many years have we been doing these? But yes, it is. This is mine. We're going to talk about the OSEP letter to Flanagan, and then we're going to do the letter on highly mobile children, and that'll be Jeanette. So apologize for that. So I think we need to go back one more slide, Shoshana. Perfect. All right. So this is a letter that came in from a diocese in Florida, asking 3 different questions regarding IDEA's equitable service requirements. And so here's the 3 or 4 takeaways from the letter. One is that for all children who are in parentally placed private school children with disabilities, and that's the PPSCWD acronym that I've made up, if that they've been found eligible for special education, they must be included in the proportionate share calculation, regardless of whether they're actually receiving services through an equitable service plan. So if they've been found eligible through an evaluation conducted by the LEA, then they must be included in the count. We've also mentioned, and as a result of sort of some questions from the diocese, is that when you determine the types of equitable services that have been provided through and proportionate share services, the venue for that really is through timing and meaningful consultation. It's an important process that's led by the school district where the private schools are located, potentially involves private school representatives and potentially includes parents, depending on whether homeschooling is considered a private school in a state. But that's the process of determining what the types of equitable service will be delivered to children, to parentally placed children with disabilities in private schools. And then the third question and sort of concept that we got asked about is about the role of MOUs. And this is the second sort of policy letter of guidance, we've addressed MOUs. While so once again, to reiterate that the LEAs are ultimately responsible for providing equitable services. We don't require and we don't prohibit the use of a memorandum of understanding in facilitating how service can be provided and sort of working out sort of logistics that may not actually be provided in the notice to private schools, but sort of arranging like how the timing of when service is provided, that might all be incorporated in an MOU. But you can't deny services to children with disabilities who are permanently placed if the private school refuses to sign the memorandum of understanding. And ultimately, any MOU that gets developed by a school district has to be consistent with IDA. So, for example, having a MOU saying that the only way that you could address a dispute is through arbitration would be inconsistent, because we know that IDA allows for complaints to be filed by the private school representatives and for situations where, for example, child find wasn't being conducted appropriately, or that meaningful consultation wasn't being conducted. So you can't have anything of those agreements that would violate an IDA requirement. All right, so the next slide is some takeaways. So just a reminder, I know we've talked about it a lot in our updates, and I think we've sent out email blasts and tweets about it, but we did issue in 2022 revised guidance on the responsibilities and the rights of permanently placed children with disabilities who are attending private schools. And you can see why I like the acronym. It's such a mouthful to use. But we're always wanting to make sure that if you're aware of LEAs that haven't had a chance to look at it or are not familiar with it, we strongly encourage it. I know it's, Lisa Pagano and Laura Dua spent a lot of time and worked with our Office of Non-Public Education and our General Counsel's office in getting it issued. We have a brand new section on vouchers that has been of interest to a lot of individuals. So definitely recommend taking a look at it. Also, our one of our TA centers, MCSI, has a great self-assessment for states to look at and make sure that they, can ensure that the equitable service requirements are being implemented correctly by their LEAs. So it's a great attachment. The link is live. So it definitely look at that if you're not familiar with all the requirements or need a little catch up or refresh. I would highly recommend it and make sure that you feel like your systems are meeting ID's requirements. And this is just something that I know some people are aware of, but not necessarily everyone, is that that the equitable service requirements is the only section of IDA that where secretarial review of a state complaint decision is allowed. So if a private school is dissatisfied with the state's decision regarding the complaint provisions and the equitable service requirements, they have the ability to file a request for review with secretary, which then gets referred to us. And it's a challenging process, and definitely want to make sure that that everyone understands the requirements and is really able to implement them consistently, because we don't necessarily want to have to get involved in reviews of state decisions, and I imagine you wouldn't want us to get involved in review your state decisions. So so that's our takeaways from Flanagan. Now I think we can pass over to Jeanette and the discussion about highly mobile children.
Yep. Sorry about that, Dan. Thought we had talked about changing order, but I must have messed up. Sorry. So hello again, everyone. Yes, I'm going to talk to you now about the policy letter issued last November on ensuring high quality education for highly mobile children. And highly mobile children include military connected children, migratory children, children who are homeless, and children in the foster care. And this letter serves as an update to the Dear Colleague letter that was originally issued in July of 2013. So the need to update the original letter came out of our work with the Military Interstate Children's Compact Commission, or the MIC3, and as follow-up to Secretary Cardona's February 9th, 2022 letter to chief state school officers regarding military-connected students and their families. And so in that letter, the Secretary outlined 4 critical practices for states to consider implementing in order to serve all highly mobile children. This letter reminds state education agencies again of their obligation to make a free, appropriate public education available to highly mobile children with disabilities under IDEA and addresses two primary areas of concern. Next slide, please. So the first issue is the requirement of timely and expedited evaluations and eligibility determinations, which can be challenging when students are transitioning between schools in the middle of that process. And so it talks about the importance of strong communication and exchange of information between the two schools, and conveys an urgency to complete the process as quickly as possible. This letter too makes it clear that MTSS or RTI strategies cannot be used to delay or deny a timely evaluation for a child suspected of having a disability. And so again, I reference you back to that OSEP memorandum 1607 that was linked in the previous slide and just re-released. So the second issue addressed in this letter is about the obligation to provide comparable services to highly mobile children with IEPs who transfer into a new school district, whether in the same state or a different state in the same school year, until such time that the new school district adopts the previous IEP or conducts evaluations and develops a new IEP. And so these comparable services include ESY services if they were on the incoming IEP. So as you think about, again, implementation, what organizational structures need to be in place to ensure that both of these requirements happen in a timely fashion so as not to further disrupt the student's education. And as state leaders, how do you communicate these requirements and the related expectations around implementation with your LEAs? And so finally, just want to point out that there are a lot of military and family resources from the Department of Ed and the Department of Health and Human Services, as well as our department-funded TA centers. And so if your LEAs, especially those serving high numbers of military-connected families, don't know about some of these resources, like the MIC3 Compact, I encourage you, please encourage them to visit the website and share with families. And of course, if you weren't aware, also our parent information centers have resources that are very specific to military family needs. And so now, once again, I will leave you and pass the mic, I believe, to Susan Kaufman.
Great, thank you, Jeanette. Hi, my name is Susan Kaufman, and I am a member of the OSEP fiscal implementation team. And today I'm going to briefly talk about OSEP's new prior approval guidance for common prior approval requests under IDA Part B and Part C, also known as Policy Support Document 2203. As most of us are familiar with the requirements that under IDA and the OMB uniform guidance, certain items of direct cost are unallowable. Next slide, sorry, we're behind. Certain items of direct cost are unallowable when expending the IDA Part B or Part C funds without prior written approval from OSEP. Before this new guidance document came out, you might remember that anytime you had a request that needed prior approval, OSEP would send you a separate document. We got tired of that. We thought it was time for a change. We thought it made sense to create sort of a one-stop shop. We have merged and combined the most common costs for prior approval that we receive into this new guidance document. We really thought that having everything together would make it easier for states. This guidance has a lot of the same information, the regulatory requirements that the old guidance documents had, but we've gotten very specific on the documentation that states need to have in order to submit a comprehensive and approvable request to OSEP when you need prior approval. I really want to stress how important that is, because we know that states want to expend their funds in a timely manner. And we really don't want to have to go back and forth a lot. We don't want to have to take a lot of time. We want to get these requests approved in a timely manner. We want to help you have everything that you need to get to us so we can do that. We know how eager everyone is to get these approvals to expend these funds. There are several areas of cost in the uniform guidance that require prior approval. We have selected the 3 categories of cost in which we receive the most questions on and the most requests for prior approval. For any areas outside of this guidance document, just reach out to your OSEP state lead or your fiscal team member, because most of those will be handled more on an individualized basis. The 3 common areas of cost that we deal with the most are equipment, which is defined as per item or a unit cost of $5,000 or more. Participant support costs, such as stipends, travel allowances, registration fees, and these are for non-state employees. And also budget changes among direct cost categories. And the budget change is the cumulative amount. So you may be making smaller budget changes, but there's a threshold of when the cumulative amount exceeds or is expected to exceed 10% of the total amount of the approved budget or the total amount of your federal award. That is when you need to submit notification to OSEP that you are moving funds, you're transferring funds among direct cost categories. Next slide, please. Since we've been getting a lot of requests lately, there's some considerations we wanted to highlight. The first is prior approval even required for what you want to do? We work a lot with states, and oftentimes you don't need prior approval. We appreciate you asking. If you don't know, please ask. But I want to bring your attention to OSER's October 2019 FAQ memo. Some of you probably remember that. That memo was intended to provide flexibility to states, to reduce burden to states, to OSEP, OSERS. And it did that by providing prior approval in 4 categories of participant support costs, and also for equipment that is charged to either Part B or Part C grants for the delivery of services on the IEP or IFSP to ensure that those services can be provided in a timely manner. So I really recommend going back to this. This is a great FAQ memo that was issued. It is posted on our website, and take a look at this and see, if your cost falls into any of these categories, because we have granted some prior approvals already. If your cost does not fall within the scope of the OSER's FAQ, then you will need to submit a written prior approval request to OSEP. And here I want to highlight some of the general factors affecting the allowability of the costs under the cost principles of the uniform guidance that we are looking for, that we expect you have supporting documentation to provide us on. And that is the cost necessary, reasonable, and allocable? We have a lot of questions around what OSEP is looking for, specifically around reasonable or procurement. That's where your procurement process comes into place. We need evidence that you have followed your state procurement process, federal procurement. Procurement really tells us what you want to spend and why it is reasonable. So our expectation is that when you submit your request to us, you have that information and that you can demonstrate that you have followed the process and that you have the evidence to support it. Another factor to take into account is to figure out if you will need to transfer funds among direct cost categories in order to obtain prior approval for the costs that were not previously budgeted for. We have a lot of situations where states do need to transfer funds among direct cost categories, and that triggers the 10%. And in those cases, we will need to see the budget change notification before we are able to approve a prior approval request for, let's say, equipment. So if you need to move funds in your budget, you need to work with us to do the budget change first, and then we can work with you on the actual prior approval for the direct cost. And just a reminder, this has not changed, that SCAs will continue to have the authority as the pass-through entity to review and approve LEA's requests to use IDA Part B funds for the purchase of equipment through your general supervision systems. And also, something a little bit new is the Consolidated Appropriations Act provided state lead agencies with the flexibility to subgrant Part C funds to eligible entities. If you are doing that, let OSEP know, but also the state lead agency will then be responsible and have the authority as the pass-through entity to review and approve the use of IDA funds for the purchase of equipment. So that changes a little bit for the Part C side. So I hope you all take a look at the guidance. The old OSERS, it's not old, but the 2019 OSERS prior approval memo. And please work with your OSEP state lead, your fiscal implementation team member. We really want to help states get their packages together so we can expedite our process and help you expend your funds, provide services, and do what you need to do. We don't want this to get held up. So please contact us if you have any questions. And now I am going to pass it on to Brian Gregg.
Thanks, Susan. I appreciate that. Hello, everyone. How you doing today? My name is Brian Gregg, and I am charged with speaking to you about a memo we put out about personnel qualifications. In October of 2022, OSEP issued this memo reminding states of the requirements within IDEA for special education teachers and related service providers. It was intended to clarify states' obligations regarding the IDEA Part B requirements related to personnel qualifications and alternate certifications. It also highlights the Secretary's call to action for which states, school districts, and institutions of higher education address teacher shortages both long and short term. Next slide, please. It includes 2 fact sheets: the department's efforts to support teacher development to attract, prepare, and retain quality educators, and a second on federal programs that may be used to sustain ARP investments, and a joint Dear Colleague letter that was released in August of 2022. This memo also touches on higher education emergency relief funds under ARP and includes resources and links that are housed on our website as well as with national TA centers. I also want to highlight that if you have any questions about this at all, please contact your state lead. They'll get in touch with me and we can absolutely schedule some time to speak about this in depth. But also I've included the link here to the actual memo. I believe I'll turn this over now to Benama. Thank you for your time today.
All right, thank you, Brian. I'll be the final presenter before Greg wraps us up. I'll be talking about the policy letter to Odinger, which was released in March of this year. 2 key issues were raised in this letter. The first here is that the questions posed: must a state or state educational agency resolve a complaint that meets the requirement of 300.153 if the child who is the subject of the complaint has graduated? And the conclusion that we came to with, of course, including explanation, but for the sake of time today, the answer is yes. And then to issue 2, must an SEA resolve a complaint that meets the requirement of, again, 300.153 if the complainant is alleging systemic non-compliance based on facts related to a child who has graduated? And also the answer to that question is yes. Next slide, please. So in the letter, we provided reasoning that, of course, started with the breakdown of the statute. We also included some notes that we received and some commentary that we received that sort of went back to the spirit of IDEA, and specifically that the complaints give parents an opportunity to raise issues that follow in the framework that follows a particular format. If the format, which is outlined in 300.153, is met, which we have here in the description, as you can see, then regardless of whether the student is outside or has graduated or is still remaining in the LEA, that the state complaint can be brought. And so again, if the student is raised, if the student is brought up as a subject to a state complaint that alleges systemic issues, we also believe that the student and IDEA requires that the student be able to bring their state complaint and be heard, provided that the requirements of the state complaint process is met. That wraps it up. There are 2 examples that we included in this policy letter, which you can see. There may be, or most likely will be, additional examples that come up as you deal with specific instances. Please reach out if you have any questions, but the letter should provide clear guidance on how states should respond to those situations. And then I will hand it over back to Greg, who will wrap us up.
Thank you, Benama, and I want to thank all of our presenters today. We got through a lot of information, but just want to remind everybody on the webinar today that policy is one of our important responsibilities. And if you want to review any of the letters that we highlighted today or other policy letters, they are all saved on our website. And it's the sites ed.gov/IDEA/policy guidance. I hope all of you are familiar with our our website, and be sure to go to the policy guidance part for these letters. And I didn't see any questions in the chat or the Q&A. So with that, again, I want to thank you all for tuning in today and thank all of our presenters for doing an excellent job at presenting this information. Thank you.